Over the course of the pandemic, care management has quickly become imperative and instrumental in patients successfully managing their health. This video is going to talk a little bit more about what care managers do and all of the ins and outs of their job. Hi, my name is Kathryn Anderton, and I am the Clinical Product Analyst here at ThoroughCare. I have a diverse background ranging from private practice to hospitals to care management. What drew me to care management was being at the bedside during the pandemic, and I saw that there was a big need for better education, especially in the discharge setting. So let's get into it and discuss the importance and significance of care managers. Care management is entirely elective. Patients have the option to do it, and at times there's even a cost associated with it or a copay. Care management is actually very diverse. It's a malleable role that can be whatever the patient needs. You can have it out of a private practice, a hospital, and really you are attending to that patient with where they're at in their healthcare. While the day-to-day of a care manager can definitely vary incredibly depending on what your patient population is going through, more often than not, it's going to entail some outreaches where you are trying to outreach new patients to have them enrolled in a chronic care management program. But then you have your existing patients who you can be following up with. Care managers first kind of assess that patient and see where they're at in managing their health, see where the deficits are and where those needs are coming up. From there, they can create a plan and guide that care to a successful goal. Actions by the care manager like making appointments, ensuring they're taking their medications as prescribed, and above all else, some patient education as well. Care managers can bridge that gap in between appointments, hopefully reducing that risk of being admitted to the hospital. Some of the administration duties of a care manager could be reviewing patient charts to ensure that the information is up to date, tracking progress, especially as it relates to relevant patient vitals and labs. A care manager can also be refilling prescriptions as needed. It could be ensuring that consent is documented and the care plan is in that electronic health record. Part of addressing patient needs is addressing all aspects of patient needs. So it's really important as care managers that we're assessing the social determinants of health, ensuring that the patient has transportation to their appointments, ensuring that they feel safe and comfortable in their home. We want to assess all of these variables to ensure that the patient is successful in managing their health and has the things that they need to be successful. So it's really learning about your population, where they're located, and what you have available to help meet those needs, and then giving the patient those resources or potentially coordinating it. As a care manager, you are working alongside a team. You need to have a great relationship with the provider to ensure that their plan of care is also being respected and followed. You, in your own office, will be potentially scheduling appointments for that patient, knowing when their annual wellness visit needs to be. All of these things involve all members of the team, from billing to front house staff to the providers. You also need to build that rapport with other providers and specialties outside of your practice. You are that point person for the patient, for everyone else. If this is interesting to you and you'd like to learn more about care management, feel free to visit the link below and also like and subscribe for other information to come.